Namaskar and good evening, everyone. I extend a warm welcome to all participants joining us for this insightful online workshop on systematic review and meta-analysis organized by Integrated Foundation Uttarakhand and Integrated Association of Medical, Basic and Social Scientists IAMBSS in collaboration with National Institute of Nursing Education, PGI-MER Chandigarh and AIMS Rishikesh. It's truly an honor to be part of such a prestigious gathering where we delve into evidence based research methodologies that play a crucial role in healthcare and medical sciences. We are privileged to have among us our renowned guest, Dr. Meenu Singh, Honorable Executive Director and CEO of AIMS Rishikesh, Dr. Sukhpal Kaur, Professor cum Principal at the National Institute of Nursing Education, PGI-MER Chandigarh, Dr. Vinay Kumar, Associate Professor, Unit of Orthodontics, Oral Health Sciences Research Center, PGI-MER Chandigarh, Dr. Jitendra Gairula, President, Integrated Foundation Uttarakhand and founder of IMPSS. Before we begin, let me briefly introduce myself. I am Priyanka Unyal, a scholar from UPES, and I will be your moderator for today's session. To set the stage, to set the this insightful workshop, it is my privilege to introduce a distinguished leader in a field of medical research and innovation, Dr. Jitendra Garola. Dr. Garola is the president of Integrated Foundation Uttarakhand and founder of IMBSS. Dr. Garola currently serves as a consultant at Center of Excellence for Use of Drones in Medicine, Department of Telemedicine, AIMS Rishikesh. With extensive experience as a former senior resident at AIMS Rishikesh and a research scientist at PGI-MER Chandigarh, he has contributed significantly to medical research with scientific publications in reputed national and international journals. His leadership in training programs for drone-based healthcare services in Uttarakhand further underscores his commitment to innovation in healthcare delivery. Today, he will give us a brief introduction to this workshop, highlighting the objectives and key takeaways. Without further ado, I invite Dr. Jitendra to share his thoughts.
Thank you, Dr. Pinka. Good evening, everyone. So on behalf of our organizing team, I extend my warm greetings to all of you. And we are delighted to have our first day speakers. We have Professor Meenu Singh ma'am. Ma'am is the director and the CEO of AIMS Rishikesh. Professor Sukhpal Kaur, Dr. Ashok, and Dr. Vinay Kumar. So in this SRMA workshop, there are over 200 participants from various the prestigious institutions, including AIMS Delhi, PGI-MER Chandigarh, AIMS Rishikesh, AIMS Patna, AIMS Guwahati, AIMS Jodhpur, AIMS Jammu, AIMS Bhopal, as well as participants from various other renowned universities and also few participants from ICMR. They are participating in the 7-day workshop. So we warmly welcome all the participants. So throughout this workshop, we will cover all the essentials steps in systematic review and meta-analysis through understanding of all the essential steps of the SRMA protocols. And we will also have the technical sessions. Yesterday, we had a technical session on our software. So in addition to this, I request all the participants to also take part in the daily quiz. So we'll ask 3 questions after each session, and there will be a chance to win the exciting prizes. So thank you very much for joining us, and we look forward to have insightful learning experience from this workshop. Stay connected with us for the future activities of the Integrated Foundation. So thank you very much. Thank you, Dr. Priyanka.
Thank you so much, Dr. Jitendra, for setting the foundation for this online workshop. Next, we have Dr. Sukhpal, who will provide an overview of systematic review and meta-analysis, its importance in research and methodology involved. Dr. Kaur is currently serving as Professor cum principal at the National Institute of Nursing Education PGI-MER Chandigarh. She holds a PhD from the Department of Pulmonary Medicine PGI-MER Chandigarh. With 32 years of experience in clinical and teaching, she has led 20 founded research projects with ICMR, DBT, DST, and authored 240 plus publications, 37 book chapters, and 9 textbooks. Now we are eager to hear your insights. Over to you, Dr. Sukhpal.
Thank you so much, Priyanka. And at the outset, I would like to thank all the organizers, specifically Dr. Jitender, Dr. Ashok, and their team for organizing such an important workshop for the 7 days, and on the top of collaborating with Nine. So Nine is really privileged to be part of this important workshop. And I'm again privileged that I have been given the chance to interact with on the very first day, just beginning of the systematic review, the introductory part of systematic review and meta-analysis. So without any delay, I would like to start my session. Let me share my screen. Are my slides visible?
Yes, ma'am.
Okay.
Yes, ma'am.
Okay. Okay. Thank you, Ashok. Thank you.
Thank you, ma'am.
So let me begin the introduction of very, very important topic, that is the systematic review. And usually we see that there are thousands of research articles which are published monthly, number of RCTs are published monthly, and they are updated in the global databases. And it's very, very important for a decision maker, for a policy maker, to read each and every individually carried out primary research, because all the researchers or the studies, they may differ in methodology, they may differ in interventions, and a number of other things. So that is why, to summarize the existing already proven evidences in the form of RCTs, systematic reviews are very, very important. Basically, the systematic reviews, they provide a high quality synthesis of the existing evidence. They help guide clinical decision making and policy making. They also identify the gap for the future research, and they help the practitioners to keep themselves up to date with the evidences which are accumulating in the field, and later on to practice the evidence-based medicine. I think majority of you might be aware of the pyramid of the evidence. We know that at the top, we have the systematic reviews. And as we go down in the pyramid, at the bottom, we have the expert opinions or just the background information. And we also know that as we go up from the bottom to the up, the bias in decreases, and the quality of the evidences increases. You can see here at the top, we have systematic review and RCTs, cohort studies, but in the bottom, we have experts' opinions without, having much of the authenticated information. So that is why it's very, very important to carry out the systematic review, so that we are able to take out the robust evidences in order to improve the quality of care which can be provided to the patients based on the evidences we have. So having said that, let's see what is a systematic review. In the systematic review, we can see that there are two words involved, because why I am talking basic is there could be number of novice people who are attending this workshop for the first time. So we have two words involved in the systematic review. One is systematic and second is the review. Systematic, from the word, it should be clear that it is anything which we do, or in a very fixed manner. Once we do the things in a very planned manner with the robust methodological things, it can be a research, it can be a non-research thing. So once anything is done very, very systematically, that is called a systematic. And review, if we talk here, this is the critical appraisal of the other work. because whatever studies later on we include in our systematic review, it is not that we just included and we involve those studies in the evidences. We need to critically appraise each and every research, whatever we are including in our review. So this is the systematic review. So systematic review is nothing but it is the structured, comprehensive analysis of the research studies on a specific topic. It always follows a rigorous methodology to ensure the reliability and to minimize the bias. Whatever research studies we identify to be included in the systematic review, they are to be appraised and synthesized according to the predetermined and explicit method. We always have certain inclusion and exclusion criteria. So if a particular study is falling in that particular inclusion exclusion criteria, then only we carry it forward. Another important thing to understand is systematic review as such can be carried out standalone, but the meta-analysis as such cannot be carried out until unless we have the systematic review. So meta-analysis is nothing but a statistical technique for combining the results of the multiple studies to produce a single estimate of the overall effect. There are certain key characteristics of the systematic review. In systematic review, we always have a very, very clearly defined research question in the form of PICOT format, or it can be PICOTS format. It always includes a structured and comprehensive literature search. We always have certain keywords as per the research question we have formulated. We always have certain predefined inclusion and exclusion criteria, like what kind of studies are to be included in a particular kind of research studies. And it's a very, very transparent methodology which is to be carried out in order to undergo the systematic review. Before going further, let me differentiate between the systematic review and the other kind of literature review which usually we carry out. So in systematic review, if we talk from question point of view, we always have a very, very focused question. However, in literature review, it may not be necessarily a single focused questions, but it may just describe an overview of that question. There is always a protocol to be prepared, to be included, peer-reviewed protocol we need to have in a systematic review. However, we don't plan any structured protocol in case of the literature review or the narrative reviews. Background, definitely we have to carry out whether we talk of the systematic review or we talk of the literature review. In objectives point of view, we need to have very, very clear, explicit objectives in case of systematic review. However, the objectives may or may not be identified in case of the normal literature review. We usually have very, very explicit inclusion criteria and the exclusion criteria. The criteria is to be stated before reviewing. But as such, in literature review, we don't have any inclusion and exclusion criteria. Here, if you talk of inclusion and exclusion criteria, this is what kind of studies you want to include, whether you want to include RCTs or you want to include the descriptive studies, or what kind of literature you want to include in the systematic review. Usually, we don't go for this particular thing in case of the normal literature review. The search strategies are very, very comprehensively planned in case of systematic review. However, in case of literature review, search strategies are not usually stated. The article selection in case of systematic review is very, very clear what kind of studies are to be included. They are very, very explicit and are applicable. These are not always in case of literature review, wherein we just decide about some topic and we start collecting the kind of studies, whatever has been done on that particular topic. The process of evaluating the research in case of systematic review, it's very, very comprehensive evaluation of each and every study which has been selected to be included in the systematic review. And in literature review, there is evaluation of the study quality that may or may not be included. As such, we don't define that this is the evaluation criteria which is to be there in the literature review. The results and data census, there is always a very clear summaries which is based on the high quality evidence in case of systematic review. But in case of literature review, the summary there that is based on the studies where the quality of articles may not be much specified. And it may also be influenced by the reviewers' theories, needs, and beliefs. Discussion, definitely it is there in case of both the cases, and this discussion and dissemination, whether we are doing systematic review or literature review, it is same in both the cases, whether we want to publish it or not. So let's see what are the key stages in systematic review. There are basically 8 stages in the process of systematic review. We will be discussing each and every stage today, and in all the next 7 days, each and every stage will be detailed by the experts on the systematic review. So the first one is formulating a research question, or whether it is a review question or a research question. It is followed by development of a protocol, which is to be registered in the Prospero. Following this, we need to identify the relevant studies. We need to develop a comprehensive search strategy and undertake the systematic review. After this, we need to assess the eligibility of the studies. We need to select those studies which will be meeting the predefined inclusion criteria. After this, there will be data extraction. It will be followed by assessments, study assessment and appraisal of the studies which we have thought of to be included in the systematic review for the quality and the validity of the studies. This will be followed by the data synthesis. It can be narratively described if it is a qualitative kind of studies, or it is to be statistically, statistically it is to be done in the form of a meta-analysis. After this, once we have finished, the last point is knowledge translation, which is to be done by writing the paper and then presenting it or publishing it in the good journal. So this is the process of the systematic review, and we need to understand each and every step. You can see here, it is a very, very systematic process of carrying out the things. That is why it is called the systematic review. Now, let us take each step one by one. So the first one is defining the research or the review question. It's very, very important to have a relevant question, relevant clinical question, because until and unless our question is not clear, there is no fun of carrying out the systematic review. So a relevant, good question, clear question, it is the key to the systematic review. So well-formulated questions will guide many aspects of the review process, like searching the strategy. What kind of strategies are we going to adopt to carry out that particular systematic review? What will be the inclusion and exclusion criteria? It depends. If it is, qualitative kind of studies, we'll be going for the more of the qualitative kind of data, more of the qualitative kind of studies. If it is a meta synthesis we are thinking of, then it will be followed by data extraction, and it also helps us to understand the choice of the synthesis method, what kind of analysis is to be carried out. And it also helps us to understand the presentation and the dissemination of the findings. So this is the basic and the foremost step, very, very important step to carry out the systematic review. So once you have decided, and even before that, there should be a group of people who should be working together. So identification of the committed review authors and forming a team, it is very, very important, because systematic review just cannot be carried out by a single individual. It is always a group of people who are expert, who are committed review authors. Then only we can think of carrying out the systematic review successfully. So this is how we have to formulate the research question in the form of PCOT. So all of you might be clear of what is the full form of PCOT. P is for the population. That means who is studied. I is the intervention. What is being tested. C is the comparison. What is the alternative intervention? It can be the routine practices or whatever things we have planned out in comparison to the intervention. And what is the O is for the outcome, that what is measured, and T is the time frame, that is the study duration, that is in how much time period we want the effectiveness of a particular thing to happen. So from this example, you can see here, so this is just to give you an example, just to make the things clear, specifically to the novice person, that a systematic review on the effectiveness of mindfulness therapy in reducing the anxiety among the nursing students. So here you can see our population is the nursing students. I, intervention, is the mindfulness therapy. C, comparison, is the routine practices, or Some other therapy could also be there. O is the outcome, that is the anxiety. And T is for the time frame, which includes study duration within 30 days. So this is how we have to write our research question, taking into consideration each and every component in the form of PCOT. Following this, we need to develop the protocol. Now, here or one thing more, I would like to say that once you have thought of doing systematic review on a particular topic, you need to understand that no one has done, or I mean, some systematic review has already been done quite fast. And so recently conducted systematic review on that particular topic should not be there. Otherwise, later on, you will definitely find difficulty in publishing that particular topic. So it should be novice in itself, and no systematic review should have been conducted in the recent past. Now you have decided about your research question. Now we need to develop the protocol. Protocol is again one of the most important feature which distinguish a systematic review from the narrative review, as we have already discussed in the once we were differentiating between the two kinds of review. So here in systematic review, we have a protocol, very explicit protocol we need to have, which will be defining the inclusion criteria, exclusion criteria, methods, and the outcome to be synthesized. So the protocol, once we are developing the protocol, we need to take into consideration these particular steps in the systematic review. We need to write the study background. We need to write the research question as well as the objectives. We need to understand the eligibility criteria for the study selections, like you want to go for the 5 years, for the 10 years, or since the inception, maybe it depends upon the kind of research question you have decided. Then you need to write the search strategy, that what all kind of databases you are going to study. For example, it can be PubMed, it can be Embase, it can be Web of Science, it can be Senehal, depending upon at least 3 to 4 databases we need to study for the search strategies. We need to understand the keywords. It depends upon your research question. We need to take out the keywords from there, and we'll be making use of the Boolean operators and or not. These are the 3 Boolean operators I'll be discussing in the subsequent slides. We need to write the inclusion and exclusion criteria of the study selections, what is the method of data extraction, how we will be doing the quality assessment of the studies, which we will be including in the systematic review, and what is the plan for the data synthesis, what is the plan for the dissemination of our systematic review, and how many people are involved, how many authors are there, and what is the roles and responsibility of each and every author, and what is the timetable, I mean, what is the time frame that when we are going to start with the search strategies, and how we are going to take away whole of the research process, how much time it's going to take. Usually it's around 6 months or so we plan at the time of in the beginning itself. So our protocol should cover each and every step in a systematic manner. We need to remember that this protocol, it is a roadmap. We need to follow each and every step. Again, we are going back to systematic things, that this is the protocol which is very systematically prepared, and we just cannot think of going further until and unless we have completed the previous step. So we need to go very methodically to cover each and every step of the protocol. So once you have prepared your protocol, we need to register the protocol in Prospero. So systematic reviews are registered in the Prospero. Prospero is nothing but this is the International Prospero Register of the Systematic Review. And this is the link. We need to register ourselves first, and we have a separate session how to register on the Prospero. So we will not be discussing in detail here, but it is very important to register our research protocols on the Prospero, because SRs are often used as the basis for health and social care policy decisions. So it should be robust and free of bias. I mean, there should be not any duplication of the things. If someone has already done the reviews, a systematic review on a particular topic, there is no need to unnecessarily waste the money and the resources. researchers can check if there are already any planned reviews. That also you will come to know from the Prospero itself. And it also offers us the opportunities for the collaboration. If someone has already done SR on a particular topic, you will come to know that it is already undergoing. So we will come to know that so and so person is doing. Later on, we can definitely collaborate with those particular person and can think of doing new things in the future. Now we have registered the protocol. Now let's go on the next step, which involves the literature search and the study selection. These are the common databases which we make use of for the literature search. This include the PubMed, Cochrane, Sinahal, Embase, Web of Science, etc. So for that matter, we need to have the search term. For example, the example I was discussing about effectiveness of mindfulness therapy on the anxiety level of the nursing students. So here the search terms can be mindful, mindfulness-based intervention, anxiety, and the nursing students. So we need to make use of the Boolean operators, which include and, or not. So here the Boolean operators, like it can be mindfulness or mindfulness based intervention. So or means either any of these two. If we take and mindfulness and anxiety and nursing students, that means our reviews will be including all the three words. And if it is mindfulness and anxiety and nursing students, not high school, so these three we are including, but not the high school students. So according to our research questions, we need to plan all the researchers or all the authors, they need to sit together specifically in the beginning in order to understand the keywords, in order to understand how to put up these Boolean operators. So this is just to give you an example. In one of our study, we have the search strategies in different databases. So these were the search strategies we had in PubMed, Scopus, and Web of Science. And these are the number of articles which we could retrieve in the beginning. Okay, after this, we need to download the literature search records and we need to select the studies, because whatever research studies are coming, all the studies will not be of for use for us. So we need to select those studies. So for that matter, we need to download the records from all the databases into the bibliographic or certain reference manager software. And the commonly used softwares are the EndNote, Revman, ProCite, even the Mendeley. So how to make use of these softwares, we need to understand, we need to learn. Probably we are going to have a separate session on these softwares. Then we need to screen the titles and the abstracts for the relevance, because many of the articles will be out once we be screening the titles and the abstracts. Then we need to apply the inclusion and the exclusion criteria. Further, we will be removing the duplicate records across different databases. Then further, deduplicating things are to be removed, and it will really be reducing the number of the records once unnecessarily studies will be removed from our records. Then we need to document the process using the Prisma flow diagrams. This will be discussed in the subsequent slides. So once we are doing the study selection, it is important that two authors should be doing subsequently. So each and every study is to be screened properly. And when there is a doubt about an article decision, the team should be inclusive rather than exclusive, until the main leader like PI make the decision after the discussion, and they come on the consensus whether to include that particular study or not. And all the excluded records, they should also be given the exclusion reason why we are excluding a particular kind of study. That reason we need to give, because we have to write in the Prisma flow diagram. So this is again to give you an overview of the Prisma flow diagram. Here you can see in the initially identifications, we could take out these are the number of studies from PubMed. We have 2 from Scopus 20, Web of Science 22, Screen Direct 2, Senehal 2, Embase 6, Procast 208, and other registers, none. And additional records can also be taken out. Manually, certain studies can also be searched, though also we have to mention. So from this, we will be doing the screenings and records after duplicate remove out of all these. We have 235, and then record screens based on the title and abstracts. Out of 235, 221 were excluded. Then after this, we could retrieve only full text articles based on the eligibility 14. And out of these, even full text articles, certain were excluded, outcomes were not defined, other team members along with, it depends upon your research questions. So we have to exclude certain studies, and ultimately we could get only 8 studies for review and meta-analysis. Now, further, we will be doing the data extraction. And 2 different investigators will be extracting the data based on the objectives and form of the study. Thereafter, the extracted data are to be re-reviewed. So information which we need to collect from the studies include the methodology part, the population, the intervention being compared, and even the outcomes. So the investigators, they resolve the differences by opinions by debate, and if they fail to reach a consensus, a third reviewer is to be consulted. For data extraction software, there are a number of softwares are available. It can be done in Word, it can be in Excel, it can be Covidence and the Revman. Some of the database softwares are paid and some are free. But of course, we need to understand how to make use of a particular kind of database. After this, we need to go for the data extraction and should have a specific table which will be giving us about the main part of that particular study, which may include the author, title, the date of publication of that particular study, and even the journal name, even the country of the study where it was carried out, what was the aim, objective, or the purpose, what was the study population focused on, and even the sample size also to be added here. What were the key findings of that particular study and the recommendations. So for all the studies you will be preparing, this is just the template. For all the studies, you will be adding the data in this particular format. Another important thing to understand is the risk of bias assessment. It is very, very important because it plays the crucial role in evaluating the studies which are included in the systematic review and meta-analysis. If the bias is more, we may not have to take that particular study in the systematic review and the meta-analysis. So what are the various kinds of risk of bias? It can be the selection bias, it can be the performance bias, it can be the detection bias, it can be attrition bias, or it can be the reporting bias. Selection bias, these biases are the research studies which we have, which we will be including in our, going for the systematic review and the meta-analysis. In selection bias, we will see whether the randomization was done properly or not. In performance base, we will be looking for whether the participants and the personnel were blinded or not. In detection bias, we'll be looking for whether the outcome assessors were blinded or not. And in attrition, was there significant loss to follow up? And in the reporting bias, were all the outcomes reported or not? So it's very, very important to look for these kind of biases, and we have different kinds of tools to assess the risk of bias. These are the commonly used tools to assess the risk of bias. It depends upon the kind of study also. Like Cochrane Risk of Bias Tool, ROB2, this is used for the randomized controlled trials, RCTs. Robbins 1, this is used for the non-randomized interventional studies. Newcastle Ottawa Scale, NOS, this is used for the cohort and the case control studies. JBI Critical Appraisal Checklist for various study designs we can make use of. And Quads 2, it is for the diagnosis accuracy studies. So depending upon the kind of studies you have, you need to select a particular kind of tool and to assess the risk of bias. And once we assess the risk, because each tool has its own scoring system. So rating can be done as low, moderate, serious, or very critical risk of bias. So from the risk of bias, you will see, you have to report that, and then you will see whether to include that particular study in the further systematic review, particularly for the meta-analysis or not. Similarly, quality assessment and critical appraisal also to be carried out. Here also we have the different tests. For the RCTs, we have Cochrane risk of bias tool, observation studies, Newcastle. We have already discussed that. And systematic reviews, we have the Amster 2 checklist. This is just to give you an example. This is the Newcastle software which we made use of in one of the studies. So here you can see these are the authors or these are the studies. So stars are to be given as per the bias. Like here you can see whether you could assess the representativeness of the sample. 1 star is given, sample size 400, another star, like assessment of the screening and surveillance tool, 2 stars, investigator of potential confounder, 1 star, assessment of the outcome, and the statistical test. So maximum score for this particular Newcastle Ottawa quality assessment scale is the 9. So accordingly, you have to score, like you can see here, for first study it is 6, then 6, then even it is 2, 5, 6. And this is the kind of score you have to give for each and every study. So you will be then you will be totaling it, and high quality study. This is again as per the Newcastle Ottawa scale only. High quality studies when the risk of bias is scoring is 7 to 9. If it is a 4 to 6, it is of moderate quality, and low quality if the score is 0 to 3. So here you again have to think of whether to include the studies as per the scoring in the meta-analysis or not. Following this, you will be going for the data census and interpretation methods. Again, it depends upon your research question. If it is a qualitative census, then we will be going for the narrative reviews. We have different kind of qualitative analysis software available. Then further, you will be summarizing the themes and the patterns. However, if it is the quantitative studies synthesis, you will be going for the meta-analysis. Number of statistical tests are available. You will be calculating the effect size, the odds ratio, the confidence interval, heterogeneity, all this, which is the I-square statistic, each and everything you will be calculating in case of the quantitative synthesis. So various softwares are available for the meta-analysis, which include the REMN and OpenMeta and number of other statistical softwares, which are free. Of course, some are on the, you have to pay for certain kind of softwares. We also need to understand the heterogeneity. This is the variability among studies in a meta-analysis, which can be the clinical, it can be methodological, or it can be statistical. Clinical, once the differences in the study population or interventions are there, if there is a variation in the studies design or quality, this is the methodological, or if it is statistical, then there could be variability in the effect size. Basically, purpose here is to assess whether pulling the data is appropriate or not. So this is denoted by I-square statistic. It gives the percentage which tells the variability about the results of the study. You can see here it is denoted by I-square. Again, further categorization is done depending upon the percentage of heterogeneity we have. Like if it is 0 to 25, this is a low heterogeneity, 25 to 50%, moderate, 50 to 75%, it is high heterogeneity, and more than 75% is the very, very high heterogeneity. This is the forest plot. Again, for the novice people, it will be a little difficult, but of course, with over the period of time, you will learn how to interpret the forest plot. So it's very, very important to understand and interpret it. So key components here we see, we have the horizontal line, which depicts the confidence interval. The vertical line, this is the line of no effect. We have a diamond, which shows the summary or the pooled effect of the things, and its width, and if it is a narrow, those things are also depicted. Like if the width of the diamond is more, that depicts the confidence interval. If it is a narrow diamond, then indicators of the high precision in the pooled estimate. So if it is wider, then that means there is a more variability and there is more uncertainty of the findings. Then you can see here we have the squares. You can see here these are the squares which are telling us about the studies, and the size of the square tells us the weight of the study. Then here you can see this is the line, and this side it is favoring the experiment, and this side it is the favoring the control. And this is the heterogeneity. You can see here, if it is 99%, that means it is high heterogeneity. And if the heterogeneity is more, then definitely you have to go for the statistics, or even the tau square we can make use of, or even we can go for the further analysis. So a random effect model, I think we can make use of if the heterogeneity is more. So for I mean, each and everything we need to understand about this particular forest plot. So these are the studies which were included in this particular forest plot. So once we have done the statistical analysis, ultimately it is the reporting and the conclusion time, and we need to follow the PRISMA guidelines in order to report the systematic reviews. We need to summarize all the key findings. We need to discuss the limitations as well as what all kind of biases were there. They can be given in the form of supplementary files. And depending upon the kind of results we get from the systematic review and meta-analysis, we have to suggest for the future research direction. So to conclude my presentation, I want to say that systematic reviews are very, very important to be carried out because they provide a structured and transparent way to synthesize the research evidence. And they play a crucial role in the evidence-based practice, whether it is a nursing practice or it is a medical practice. In systematic review, we always follow a very, very rigorous methodology. All the steps are to be planned properly, and we have to follow each and every step very, very consistently. They help resolve the inconsistencies in the research, and they play a very, very important role in the evidence-based decision-making. Thank you very much for patient listening. Hello.
Thank you, Dr. Sukhpal, for sharing valuable insights on the introduction to systematic review and meta-analysis. Let me confirm with Dr. Jiten sir. Dr. Meenu ma'am joining us or not, please. Dr. Jiten sir.
Hello, Dr. Priyanka.
Yes, sir. So
I think
okay, sir.
ma'am has not joined yet, I think.
Okay. Due
So
to
meanwhile, we can
unavoidable-
have another lecture, no? So Dr.
yes,
Vinay is here,
yes, sir.
so we can go ahead with
Okay, so
another.
meanwhile,
she is
Dr.
joining,
Meenu Singh
so
will be joining us
yes.
later. Therefore, we proceed with our next speaker. So now we have Dr. Vinay Kumar, Associate Professor, Unit of Orthodontics, Oral Health Sciences Center, PGI MER Chandigarh. Dr. Kumar has an extensive background in orthodontics and evidence-based research with over 40 scientific publications in national and international journals. As a contributor to the Global Center of Evidence Synthesis, his work in systematic review and meta-analysis has been instrumental in advancing research methodologies. Today, he will be presenting on research questions and PICO for SRMA, guiding us through the process of formulating precise research questions using the PICO framework to enhance the quality and impact of systematic reviews. So without further ado, I invite Dr. Vinay Kumar for his insightful session.
Am I audible?
Yes, sir.
Dr. Priyanka, am I audible?
Yes, sir. Yes, sir.
Yeah, and my screen is sharing or not?
Yes, sir. Your screen is
Okay,
visible.
so at the very first outlet, thank you, Priyanka, for such a wonderful introduction. And I am basically a clinician and would try to justify the topic which has given to me, the research questions and PICO in systematic review and meta-analysis in very clinical way. I have experience regarding the systematic review past 2 or 3 years, so I am very new in this particular domain. So at the very first, this thing, my slide is, yeah. So my deep sense of gratitude to Integrated Foundation Uttarakhand, the Integrated Association of Medical Basic and Social Scientists, National Institute of Nursing Education, PGMR Chandigarh, and All India Institute of Medical Sciences Rishikesh for conducting and formulating such a beautiful program. See, today is the era of evidence, and we are doing primary researches. Now it is the time to synthesize a strong evidence that in every field of the medicines or basic sciences, some meaningful evidences can be generated, so that that particular researches, they are meaningful to the society. So this is, I'm going to cover but the basic understanding of research questions. What exactly is a research questions in systematic review and meta-analysis, and what are the basic skeletal steps to develop a research question, what are the various criteria for the development, and few examples by which I will try to justify this topic to the audience. So the very first thing that comes in mind, that whenever we are planning a study or a systematic review for evidence synthesis, what should be the query? So what is the research questions? Basically, a research question is a question that a study or a research project aims to answer, and it is actually answered through the concrete analysis and interpretation of the data, which basically we get throughout that project. So this is the step-by-step, the ladder that is showing that the research question should have a proper validation and it should be feasible, followed by a preliminary research on that particular topic which any researchers want to do for the research, and then defining the research questions, what the queries they are generating, and how that particular queries can be answered through a planned and structured way. So this is the path by which research question is developed. The researcher has to come from the broad topic of their own choice into a specific question. So the researcher should have a topic of their interest, wide topic of interest, and then that particular topic has to be narrowed down. So suppose if someone wants to see the effect of a steroid on the asthma, so then the research topic can be broadly, it can be your either the steroids or the problem that is your asthma. So the topic selection, the main wider the topic, the better you can go into. So the researcher has to have a sound knowledge of their area of interest. Then second comes the working knowledge on the topic. So then that particular topic, the researchers has to go through the various preliminary researches to narrow down the broad topic into a very meaningful way, so that can be meaningful to the society. Then the next thing is the working question, like what the working questions can be. So basically it takes into consideration two things. One is the gap spotting. So whatever the available literature that is existing in the literature, and what are the lacunae or the thing which are actually lacking currently. And the second thing is problematization, that that particular the area where you want to work is having any meaningful, or the problems that has been created, or the generation of the problems for the for to answer the research question. Then ultimately at the final, after evaluations of all the things, the research questions is developed. So the various steps in developing a good research question is, we need to again start with a broad topic. Broad topic provides the writer with plenty of avenues to explore in their search for a viable research questions. The techniques are used to help one to develop a topic into subtopics, and the potential research questions include the brainstorming and concept mapping. So the first step is one has to have a broad topic in their mind. Choose an area of the study that you are genuinely interested in, since your interest is in a topic that will affect your motivation level and throughout your research. And one have to consider the interest being addressed recently by the research community, as this may affect your paper's chance of getting into publications. So the second step is we have to do the preliminary researches to learn about the topical issues. So again, you have to allow yourself to discover the issues that are currently being discussed by the scholars and the fellow researchers globally. Whatever the things are coming, new discoveries are made. So we have to think the currently what exactly the issues are coming in the current scenarios. This will allow you to spot existing gaps or limitations in existing knowledge of your topic. So you need to do the preliminary researches. Then the narrow down your topic and determine the potential research question that actually covers through the gap spotting and problematization. Though the focus on the gaps or lacunae that is existing in the knowledge of research of the recent literature is called as the gap spotting. So what are the gaps or the lacuna in the existing knowledge the recently that is coming? And one has to choose the research questions that extends or complement with the finding of existing literature. That is the basic structural foundation of the narrowing down of the topics. Another is the problematization, which aims basically to challenge and scrutinize the assumptions that supports other and the researcher's theoretical position. This means constructing research questions that challenge your views or the knowledge of the area of study. So basically, what in problematization happens is whatever the previous researchers has done, we have to challenge that particular concept, and with our own views, which we basically want to study in that particular with the particular knowledge of the area of study. The researchers who are also practitioners, for instances, can reflect the problematic areas of their practice. Basically, that will help to develop new things. The patterns and the trends in the practice may also provide new insights and potential research questions example. So this is the third point. The second is we have to evaluate the soundness of the research questions. So how robust, how sound is your research questions, that has to be evaluated to develop a sound research questions. And the Hule, they have proposed one criteria which basically is very that is used so frequently, which is called as the final criteria, to find out if you have a good research question. So final criteria basically is an acronym, and it basically tells us a structural foundation of having a good research question. So basically it means that F is standing for feasibility of that particular research questions, whatever you are making, that particular research question is feasible in the current scenarios, the current environment, and the current setup. And is it interesting to the readers, interesting to the society, and interesting also to the researcher, because then it will enhance his motivations to complete the research. And it should be novel. There should be novelty. It should not be the older researcher, we are just copying and pasting, and we are doing. So it should be new, and it can be ethically sound, so that it should be it can be basically get approval from the ethical review board of the institutions, and it should be relevant to the time, place, and person. So this is regarding the final criteria which has to be in the skeletal component of the research question. So this is again about the final criteria. So to construct research questions properly, we have some frameworks or criteria. So one of that kind is a SMART criteria. Basically, SMART stands for the word stands for specific, that the research questions should be focused and clear. Okay. M stands for measurable, that you should be able to measure the outcome or the variables. A stands for achievable, the questions should be feasible in the given available resources and time. R is again relevant, the question should address the significant issues, and it should be time bound. So SMART basically stands for these 5 items. The question should have a defined time frame if applicable. The second such criteria is 5W1H technique, where there are 5 W's which stands for, first is for what is being studied. Basically, it can be the topic, problems, or phenomenon. Who is involved? Basically, it is related to the population group or communities. Where is the study being conducted? You have to tell about the location, the settings. When does the study takes place? The time frame, when says for the time frame and durations. And why is the study being conducted? What is the purpose and rationale for conducting those studies, and how the study will be conducted? So it is regarding the methodology and regarding the design. So another is the space framework. Space basically, sorry, it's not space, sorry, it is a SPICE. A SPICE stands for first as is setting. Where does the study takes place? It is a clinical or a community based, or a global based. The population stands again, the who is the population being studied in that particular research question. I stands for intervention. What is the intervention or the exposure that has been studied? C again stands for comparison. What is the alternative? To whom do you want to compare with? Can be placebo, can be any other intervention, comparison with others. And E is the evaluation. What is the outcome or the effects being measured? So, but one of its own and the most widely accepted and used framework or criteria to synthesize a research question is PICO. So, Dr. Sukhvinder have already spoken about the glimpse of the PICO. PICO sometimes, or S is also called as, and third is your PEO. So this is what PICO means. PICO again is a mnemonics that is used to help you clarify your clinical questions. And it acts as a framework asking you to think specifically about the different aspects of what you want to investigate. So that it is the basic structure based on which the robustness, the novelty, and the focus of a research questions is being answered. So in a typical research questions, you have to have a P stands for patients, population, or problem. This is what is being included. And in the P, it can be your age, it can be your gender, It can be your disease condition or other demographic factors. I stands for intervention, and it can be any treatment or intervention given. It can be diagnostic test, it can be any preventive measure or other factors. C is comparison. Comparison can be placebo or a standard treatment or another intervention that has been compared with the intervention or you want to see. O stands for outcome, the clinical outcome, what you want to see, depending on the area of domain, its side effects or the quality of life that comes in the outcome measures. S stands for, sometimes S is also included, study design, which type of study you want to have, the observational study or the interventional study is randomized or non-randomized clinical trial. And again, T stands for the time frame or the type of questions you want to have. Like this is an example that in adult with hypertension. Okay, so the adults with hypertension becomes the population. How does a low sodium diet? So sodium diet here is a intervention that is compared to a standard sodium intake that is a comparator in reducing blood pressure. So the adults with hypertension is the problem, and low sodium diet, because that is to be compared, that is the intervention. Sorry, this is the intervention, low sodium diet, and it has to be compared with a standard sodium intake that is as a comparator or a standard, and in reducing the uh, 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 blood pressure. Blood pressure here actually will act as a outcome. So this is a very live example of the PICO based research question. Does the second is, does the monitoring blood glucose 4 times a day, okay, that becomes the intervention, improves blood glucose control, that is an outcome in a people with type 1 diabetes, that is the population during the first 6 months after being diagnosed with the condition. So condition after 6 months is giving the time frame you are having here. So now I am showing you some PICO template questions, which type of studies can have which type of templates. PICO generated. So for interventional study, so here how the research question is generated is in, that can be the population of which, what is the side effect of one of the treatment effects on the other, that can be your outcome to compare with uh, uh, anything, and within that specific period of time, like in the last example we have seen. So this is one of the format of generating a research questions. For etiological studies, the research questions will be framed like this. Are people that becomes actually in the population who are having some problem in that, so that becomes an intervention at increased or decreased risk for or of, that is the outcome that is compared with population with or without comparator over any set period of time. This is the template for diagnostic or diagnosis based studies. So this is your template for this, and this is for the preventive studies. So here, like if your research question is based on some preventive measures, so again the research questions can be framed in this way. So this is for the prognosis or prediction based studies in population that is becoming, how does some intervention is compared to some that influences over time, that period of time. So, and this is regarding the meaningful studies. How do the population that is diagnosed with any problem perceive any outcome during that particular period of time? So this is these are basically various templates that are used basically to frame a research question. So how good or bad is your research questions? No. So these are two examples which I am sharing for you. Is for example, how does social media affect the people's behavior? Basically, this particular research question is too vague, it is too ambiguous. Actually this particular thing has to be discussed in such a meaningful way that what effect does the daily use of any social media, in this case you can take as an example of YouTube, have on the attention span of a children aged under 16. So the second research question basically is a good question, a research question that has been framed than the first one, where it is too vague. We cannot understand what basic but particular thing the researchers want to ask. So in another example, has there been an increase in the childhood obesity in Chandigarh in past 10 years? Again, in this thing, there is no clarity of the research question. So it can be framed in another way, like how have the school intervention programs and parental education's level affect the rate of childhood obesity among first to sixth grade students. So it is basically more meaningful, more clear, and it is more focused. So these are the two examples of good and bad research questions. So basically, in a research question, ultimately you should have a very focused and some structurally sound skeleton over which it can be your PICO, it can be your PICOT, or other criteria you can apply, but it should be very, very clear. Coming to the common pitfalls in formulating research questions. So one of that is overly broad questions. So the most frequent mistake is crafting a research question that is too broad or vague. So we should not do that. It should not be too broad. It should be narrowed down to a thing where it can be easily understandable. Such questions can lead to the unfocused research and make it difficult to draw meaningful conclusion. We cannot have a meaningful conclusions. And we should aim for the specificity by clearly defining the scope and parameters of your study. So second is the lack of feasibility. So it is essential to ensure that your research question is feasible given your resources, time constraints, and access to the data. We should not plan a study where we cannot have a data, we cannot have a resources, and we are still thinking of the making that thing possible. The questions that are overly ambitious or too complex may not be practical to investigate thoroughly. So we should be very, very particular about it, and it is a very common pitfall for research question. Third is the ambiguous language. So using vague or ambiguous language, as we have seen in previous two examples of good and bad research questions, can lead to the misunderstanding about the intent and focus of the research. So we should be use that language, but it should be meaningful and non-ambiguous. This thing also lead to strive for the precision in your wording to enhance the clarity and facilitate the effective communication with your audience. So the third thing is ambiguous language, and we should avoid it. Then the fourth one is neglecting the existing literature. The failing to review existing literature before formulating your research questions can result in the redundancy or the pursuit of questions that have already been adequately addressed. Conducting a thorough literature review is vital to identify the gap in the knowledge and inform your research focus. Fifth one is ignoring the ethical considerations. See, the research question should have always consider ethical implications, especially when involving the human subjects or sensitive topics. The questions that could lead to unethical research practices or harms to the participant should be carefully reconsidered. So now, having said that regarding the robustness of the research questions basically they basically are the thing which the researchers has to find out some questions, and with the strong foundations, you have to generate a problems, and then those problems how you have to address it is basically is the generation of the research question. So I'm giving you some example here regarding the PICO based research questions and what can be their possible PICO format. The example I am taking here is from Cochrane review library. So this is the thing is the impact of the intense nursing care in improving anxiety, depression, and the quality of life in a patient with liver cancer. This is a research questions. So we need to understand what is the PICOT for this particular SRMA. So if we have to, summarize this, this is the population here in the above research question is the patient with liver cancer. The intervention or the exposure is the intense nursing care. Comparator is, here we don't have any comparator, but the outcome assess is the improvement in the anxiety and depression and quality of life. Then, so this actually is a research questions from the which says like, what are the effect of non-surgical orthodontic treatment for the children with prominent lower front teeth? So this is a research questions. Now, if we have to see the PICO from the original review, here the population is, they have taken the child or the preschool children from 2 to 5 years. They have also considered the children from 6 to 12 years. They have also, in the population domain, they have the malocclusion, and they are also having considered the adolescents from 13 to 18 years. So here the population is, they have considered in 4 domains. Now coming to the intervention, so among these patients, the interventions, they are of 2 type. One is orthodontic extraoral headgear, and second is fixed orthodontic appliances. So third, the comparison is the delayed treatment, and here they have tried to, the outcome is the, what is the horizontal overbite they have measured. So the research questions basically, this particular research questions have these uh, uh, 4 different uh, 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 structural domains which they have addressed. So the PICO format in Cochrane clinical, they are very extensively, very deeply, very deep, and they get into the everything in the in the PICO format. So this is another questions. Can promoting breastfeeding in pregnant or recently delivered mother prevent early childhood dental caries? So this is a research questions. And if we see the PICO from the original review, then they have considered the 7 different domains in that population. They have taken the adults from the 19 to 44 years. They have considered the pregnant females. They have considered the middle aged 45 to 64 year. They have considered the mothers. Just meaning to say like their population is so comprehensive. Now coming to the intervention, they have assessed the intervention in 6 different domains: the oral health education, the oral health promotion, the diet education, the breastfeeding support, the facilitation of the access to the treatment and healthcare policy. Coming to the comparison of this is usual care of the teeth, and the outcome is the missing teeth, the number of teeth which are missing or not, the drilling or the filling of the cavity of the tooth, the dental caries and dental decay. So again, that particular questions, if we put that in a PICOT format, so this is the PICOT format that will come. So what are the effects of, another example, where they have, see what are the effects of chlorhexidine, which is a mouthwash for the prevention of alveolar osteitis, that is a dry socket. So the PICO from the original review they have made is the population who are having, who are ranged in the age of 80 to over 80. Then another age group of adults having 19 to 44 years of age, middle age, young adults, tooth extractions, and age 65 to 79 years. Coming to the intervention which they have considered here is the anti-effectiveness and the antiseptics for the local treatment. Okay, they are comparing this particular thing here. The comparison they have taken is the placebo, and the outcome is the dry socket. So another is how do antifungal drugs that is compared with placebo for preventive oral candidiasis in adults and children undergo cancer treatment. So here again, they have made that in a population having 11 different domains, right from the children, preschool children to the aged till 65 to 79-year-old males, and the adolescents of 13 to 18 years and cancers. They have taken that in a population. Coming to the intervention, the intervention they have taken is primary antifungal agents having prophylaxis they have done or not. Comparison is again placebo, and outcome they have assessed is candidiasis of the mouth. So this particular research question, again, if we fragment into the PICO format, this comes the PICO format. So now this is a questions like you from the PICO, if you have to generate a research questions. So you are having a population which says that children, preschool children of 2 to 5 years, aged 80 or over 80 years, adults in the age range of 19 to 44 years, children in the age of 6 to 12 years, middle age peoples, young adults, age, and coming to intervention as zinc. Comparison is your placebo, and outcome assess is serious adverse events, common cold, and adverse effect. So what can be the research questions from this particular PICOs? So basically by looking this into account, so one can think that like what are the effects of zinc, because zinc here is coming as the intervention for the prevention and treatment of the common cold, because that was basically in the upper respiratory tract infections. So this actually becomes the PICO for the this becomes the research questions for the aforementioned PICO format. So now this was all about my presentation. Thank you very much for your patient listening. This was all from my side.